Hi, I'm Lisa Ouellette, and this is a short preview of a new working paper joint with Daniel Hemel from the University of Chicago Law School that we're both presenting at the Harvard Health Law Workshop on September 21st. The paper applies our prior work on the connection between incentives for new innovations and access to existing innovations to the context of COVID-19 vaccines, which is an issue that is continuing to cause confusion in innovation policy discussions. Daniel and I think there is a strong economic and moral case for free global access to a vaccine that is shown to be safe and effective. A vaccine won't solve everything because it will take time to distribute and won't be 100% effective, so it certainly shouldn't be our only policy priority, but it would be a big step toward controlling this pandemic. But this case for free access has led many academics, politicians, and advocates to say that we have to limit profits and patent rights for vaccine developers. For example, vaccine developers Moderna, Merck, and Pfizer were criticized this summer when they were testifying before Congress and wouldn't commit to selling their vaccines for no profit. We think these campaigns stem from an idea that profits on patent-protected medicines necessarily come at the expense of access. That's why the main strategy of advocates for access to medicines has been to focus on limiting patent rights and encouraging competition from generic manufacturers. But what Daniel and I explain is that this innovation access trade-off is a false framing, particularly for medical innovations. We think the main conceptual mistake that keeps getting made in these discussions is not distinguishing between out-of-pocket costs for patients and the entirely separate question of financial rewards for developers. In many countries, people will get free vaccines through national healthcare systems, and Americans will get free access through government insurance or through private insurance that's required to cover vaccines with no out-of-pocket costs under this language from the Affordable Care Act, or through a program the federal government has created to cover COVID-19 treatments and vaccines for uninsured patients. So vaccines can be free to patients even if their developers receive enormous financial rewards. So you might say, okay, we can have free access and large rewards, but isn't limiting profits still a good thing? But profits are important because most of the human capital and facilities related to vaccine development are in the private sector. And we want these firms to make investments in the most socially valuable projects, like scaling up manufacturing for promising vaccine candidates before we know whether they'll work. Even if a larger reward has only a small chance of speeding up access to a vaccine, it would be worth it because of the enormous cost of the pandemic. Just looking at the US, COVID-19 is estimated to add about $10 billion per day to our federal deficit. So small increases in speed could pay for themselves pretty quickly. More importantly, rewarding vaccine developers in this pandemic will help us do a better job with the next one. Both the public and private sector invested far too little in vaccine research before this pandemic because of both political and market failures. Some private sector firms did make investments before this pandemic that were the basis for the vaccines they're developing now, and we'd like to see more of that in the future. But if no one makes money on this pandemic because of demands to give everything away for free, then we'll face the same problem next time. And there will be a next pandemic. The fact that we're living through this now doesn't make it less likely to happen again soon. Our full article goes into many more details that we don't have time to discuss in this short video, including a quantitative model to show that current prices vastly undercompensate vaccine producers, and a discussion of whether the patent system is the best mechanism for transferring rewards to the private sector. But we think the key point is that policymakers need to prioritize getting a safe and effective vaccine approved and rapidly scaling up production and providing free global access to that vaccine. And these priorities aren't in conflict. To reach these goals, mobilizing the private sector is crucial. The goal shouldn't be no profits. It should be doing a better job aligning the profit incentive with things that are socially valuable.